Have you ever heard of aggressive treatment for memory loss, cognitive impairment, maybe dementia or Alzheimer's? Yeah, neither have I until recently, because I would always think that the conventional medical side of aggressive treatment would be tons of medications and pharmaceuticals to help the situation. But the paradigm of how we view, evaluate, and treat mild cognitive impairment, dementia, and certain stages of Alzheimer's is rapidly changing. And while the conventional side of medicine continues to treat this as a monomechanistic disorder with a magic bullet, the functional medicine side is viewing this and the treatment of these conditions in a whole different lens. And so maybe you're here because you're looking for a solution. Maybe you're here because you're starting to see these signs and symptoms of cognitive impairment in yourself. Maybe you're seeing them in a loved one. Maybe a loved one has already been diagnosed with dementia or Alzheimer's, or maybe you have a family history of these. Regardless of the situation, you're looking for a solution to get yourself out of mild cognitive impairment, dementia, or Alzheimer's, or maybe preventing this from happening in the first place, because we know the trail of destruction and doom that lies ahead. And so you may never ever be diagnosed with Alzheimer's. Maybe the diagnosis can't be made, or you just don't have it. But you can certainly walk around in your progressive years with the signs and symptoms that put you in a state of just being like an Alzheimer's. And I'm here to tell you that these changes over time are not normal under any circumstances at any age. And this is where we get tricked, because the longer and longer that we push this off, the presentations get more serious and we get deeper into the grips of cognitive impairment, dementia, or Alzheimer's. Hi, I'm Dr. Josh Bletzinger. I'm a chiropractor. I'm a functional medicine practitioner that focuses on the aggressive treatment of cognitive impairment, dementia, and certain stages of Alzheimer's using a carefully crafted functional medicine model. It's not very well known, but it's super effective for the patients that I'm able to use this therapy on. And not only is it good for those type of people, but it's great for the assertive and preventative management for those that are seeing themselves quite possibly in the grips of cognitive impairment or memory loss. And so I want to explain the difference between conservative management and aggressive therapy. When we look at the conventional medical model, the allopathic side of medicine, it continues to chase the monomechanistic disorder. And what I mean by that, and what I call that, is the amyloid plaquing. So we have pinned this monomechanistic disorder on amyloid plaquing for years and years and years. So the pharmaceutical companies, they ran out to make these drugs that would destroy the amyloid plaques in the brain. And when they transferred these trials to human subjects, those human subjects declined much more rapidly than they did when they were on the medications. So these billion-dollar programs, they closed the doors. And so what we're doing now is thought-forward thinking that identifies brain-related illness as a multifactorial disease process, meaning there can be many causative factors and why the brain ultimately degenerates to cause memory and cognitive impairment. This is rooted in 20 plus years of research and 50,000 pages, the evidence of multiple multifactorial disease processes that can activate neurodegeneration leading to cognitive impairment. It's a system that identifies all the causative factors or subthreats that create neurodegeneration in the brain. Like holes in the roof, you've got to plug them all to stop the leaking, because if you only plug one hole, you're still not stopping all the leaking. It's aggressive evaluation, management, and monitoring of MCI and dementia syndromes. This was first presented by Dr. Don Schmeickel at the International Conference of Alzheimer's Disease in Paris in 2011, and later put into clinical protocol through Dr. Dale Bredesen and his team at UCLA. But the guiding light is the ability to evaluate and assess neurocognitive health through leading-edge neurocognitive health assessment technologies. This evidence-based technology is age and gender specific. It's highly accurate and repeatable in measuring improvement and outcomes. And so this is why I do these seminars. This is why I put these on in a live fashion, is because I want to connect with you and I want to show you in detail how and why the brain fails. I want to show you how to identify and arrest the progress of cognitive impairment, dementia, and or Alzheimer's. And I want to show you the evaluative and therapeutic factors demonstrating remarkable outcomes through customized functional medicine care. So if you're ready to learn how to shift memory loss, if you're ready to learn the strategies of aggressive treatment and management that are producing remarkable results, here's what you do next. Take a look and see where the time, date, and location are of the next seminar. Make sure that you don't have anything going on for those next few hours, and register your seat for the event. So take a moment and do that now. Register for the event so you can finally learn the aggressive strategies that can help shift the symptoms of memory loss into remission. I'll see you at the seminar.